This award is for Personalisation of Care, supporting a home enterally fed patient to achieve his dream of running the London Marathon. Nutricia Homewood is the UK's leading medical nutrition feed and service provider. We support nearly 30,000 home enterally fed patients across the UK each year. We provide a dedicated nutrition nurse team of over 150 nurses. Our mission is to proudly transform health through nutrition for the people that we serve. Martina's worked for Nutricia for over 10 years. She works as part of a team looking after approximately 450 home enterally fed patients. In 2017, she met Gary after his neck surgery, which left him requiring a nasogastric tube. She trained him and his family on how to care for the feeding tube and for the use of the enteral feeding equipment and the feeding pump. Not long after, Gary then required a gastrostomy tube to be fitted, and Martine helped with training him and his family on how to care for this tube. The gastrostomy tube needed changing every 3 months, and it was part of one of these visits where Martine and Gary were talking, and Gary mentioned that he was hoping to run the London Marathon. Martine understood how important running was to Gary, especially achieving running the London Marathon. Running had become a new part of Gary's life. He joined a local running club and he enjoyed all of the fun that gave him. But helping Gary to achieve his goal had a wider positive effect on many others. Gary, his family, and also charities that he was involved with. So this was a really important achievement. So what did Nutricia and Martine do to support Gary? So as you can imagine, running the London Marathon is a huge feat. So we needed to make sure that Gary had enough nutrition and hydration to see him through such a long duration. So liaising with his dietitian who understood the importance of this goal for Gary as well. Martine also joined the running club, so she could in the evening run with Gary to make sure that he was able to run with his equipment on his back in a backpack, even testing different straps on his backpack to make sure that it was snug, it was comfortable, it didn't interfere with his running at all and achieving his goal. And that took quite a bit of trial and error with Martine's support. We also provided medical letters to enable him to run through the marathon with backpacks on his back. We also found him a running partner as well. So Tim Jones from our medical team ran with Gary on the day. This enabled some support, some running support with him, but equally some support with his enteral feeding equipment. So Tim also had a backpack and ran with one. And then when the nutrition ran out in the one Gary was carrying, they were able to do a swap over and Gary could carry on and be hydrated throughout such a long duration. We introduced him to Pint, so the local charity, to enable him to offer support for him there. And we also arranged press coverage for Gary because this was a huge thing for him. This was such a massive achievement and it was really something to be absolutely celebrated. So the impact of providing this personalisation of care has meant that despite it being the hottest day of the year, Gary was able to run that London Marathon and he achieved it and he absolutely smashed it on the day. He did such a good job. He continues to run marathons and he is a true inspiration for others. He has such a positive and can-do attitude and this reflects across him and his family. He also continues to provide and raise money for Pint. He's now a Pint ambassador. And he also presents at healthcare professional conferences as well. He really is an inspiration. So hopefully what you can see, the work that Martine and Nutricia have done to support Gary has been truly bespoke and individual for him to allow him to achieve his goals and be a true ambassador. Thank you.